broad-based, not disease-specific, a broad-based alternate approach.
Pharmaceutical companies produce a lot of very beneficial products. The problem is they go well beyond that to create ever new markets and expand the markets that they have. For example, a very high percentage of prescribing is what's called off-label. That means for purposes that were not approved by the FDA. So isn't it strange? We have this whole federal program for testing for safety and efficacy for specific conditions. Then once the drug is approved, it can be prescribed for anything.
The drug industry's put an awful lot of muscle on Congress and on the FDA to keep drugs that are profitable on the market. For a doctor like me, it puts us in an impossible position because drugs that should have been withdrawn may last for months or even years beyond the point where we knew they were dangerous.
A couple of years ago, there were about 600 registered pharmaceutical lobbyists. Today, only a few years later, according to USA Today, there are over 1,200 registered pharmaceutical lobbyists.
There are more lobbyists for the pharmaceutical industry in Washington than there are members of Congress. They have enormous checkbooks, and they can spend that money as they see fit. What do lobbyists do? Well, they influence legislators.
They are paying visits to members of Congress and their staff and sort of influencing them to do things the drug industry way, such as forbidding price controls on prescription drugs. In addition to that, the drug companies themselves give money to the members of Congress, and in return they get much more sympathy, both in terms of legislation that may be pending and in terms of the oversight or lack thereof that the Congress exerts over the FDA.
You've got to start to ask, could we have a better regulatory regime here that could protect the public interest more than the profits of the pharmaceutical companies? You have this entanglement at almost every level of medicine. And where it's most pernicious is at the level of the medical journals, which are at the top of the hierarchy. Medical journals are essentially the record of medical science. And even those journals are heavily dependent on drug company funding through advertising.
Scientific studies that are funded by industry are 5 times more likely to show a result that's favorable to drug companies than if the study was funded by an independent source like the National Institutes of Health.
The Eli Lilly Corporation, a pharmaceutical company, for nearly 15 years covered up their own internal investigation that showed that anyone on Prozac is 12 times more likely to attempt suicide than those using other antidepressants, not 12 times more than the average population, 12 times more than those already on other antidepressants. This is a criminal act, and I want to know why these criminals are still walking the streets.
The United States makes up less than 5% of the world's population. But in terms of the world's total bill for prescription drugs, the US makes up about half of it. So the cost of drugs and the number of prescription drugs being consumed by Americans is just through the roof.
The pharmaceutical companies are making money hand over fist. The sicker we are, the more profit for their stockholders.
What we have today are pharmaceutical industry and the American Psychiatric Association taking normal human processes and labeling it as a disease, labeling it as disorder, just so that they can sell a drug.
Just to give you an idea how ridiculous some of these mental illnesses are, one of the latest ones is post-election selection trauma. So if you happen to be politically inclined, you have to ensure you're not backing the wrong horse, because the symptoms include agitation, endless sulking, and bitterness. Psychiatrists have voted into existence, for example, palatophobia, which is the fear of bald people. We have novercophobia, which is the fear of mother-in-laws. Automatonophobia, which is the fear of ventriloquist dummies. And last year, they invented, believe it or not, with a show of hands, arachibutyrophobia, which is the fear of peanut butter sticking to the roof of your mouth.
one of the problems with our current managed care system of medicine and the way that physicians and psychiatrists, of course of no exception to that, bill for those disorders is that we must have a diagnostic label in order to generate a bill. So the more diagnostic labels you have, the more bills you can generate for those specific diagnoses.
One of the best ways to sell drugs is to sell a disease. And the drug companies have done this magnificently, from selling menopause in the mid-60s to making that a disease state instead of a natural progression, to selling osteoporosis, to selling social anxiety disorder, to selling elevated cholesterol for people who aren't at great risk. That's how they broaden the market and sell more of their drugs and generate more profits.
Psychiatry literally votes on these diseases. We protested in front of the American Psychiatric Association when they created a new psychiatric label, and we found that the psychiatric drug industry really drives this process. The psychiatric drug industry is so powerful that they can lobby the industry to create more labels, and that justifies more drugs, more varieties of uses for the drugs that already exist. And it turns out that these labels have no real science behind them at all.
There is almost nothing good to be said about present-day psychiatry. There are a handful of practitioners within psychiatry who have not deserted the Hippocratic Oath or their ethics. In pre-World War II Germany, patients had nothing resembling informed consent. They became involuntary conscripts in the medical equation. Sadly, psychology has largely followed suit, as have most across the spectrum of what is called mental health.
In the latest version of the DSM, there are now over 40 mental illnesses that children supposedly suffer from, literally from infancy. For example, separation anxiety disorder. So if you have a young child who becomes very sad and becomes very anxious when they're about to leave one of their parents, that reaction psychiatrists have labeled as a mental illness. When you have children that are in school having trouble with mathematics, that is now a mental illness labeled mathematics disorder. Reading disorder, expressive writing disorder is now being tagged on children.
If you are one of the many who suffer from overwhelming anxiety and intense fear of social situations with unfamiliar people,
when you think about social anxiety disorder, the drug company's successful campaign to take social anxiety disorder from a rare disease to a so-called common disease, in other words, manufacture a disease so they can sell antidepressants to treat it. We see organizations like Freedom from Fear, which is a nonprofit organization whose fundamental mission is to educate the public about social anxiety. Well, guess who's funding Freedom from Fear? It's the drug companies.
Side effects may include nausea, sweating, sexual side effects, weakness, insomnia, or sleepiness.
The main problem with the psychiatric drugs is that they are pushed. People are pressured to take them. People are lied to about the hazards. And the worst thing is that people are denied alternatives. I think if people were given a full range of alternatives, of real alternatives, and given full information and not pressured, I would think that very little psychiatric drugging would be going on.
Even psychiatrists themselves admit that there is no science behind any of their mental disorders.
The so-called Diagnostic and Statistical Manual is really anything but diagnostic, or statistical for that matter.
What it is a book that contains thousands of symptoms that have a number to it. When you build insurance companies, you can't say the word. You've got to send in a number. And they have numbers for the most ridiculous things. You know, like arguing with your mother, or peeing in the bed, or arguing with your sister.
So the DSM is basically an arbitrary classification of thoughts, moods, and behavior decided upon by a committee of psychiatrists who are picked by the American Psychiatric Association.
They create this cluster disease, and they get together and they vote. Is this a disease? All in favor say aye. You know, if they have a majority vote or however they vote on this cluster of normal systems, of normal behaviors together, and they create these diseases.
Each volume has grown by 15 or 20 new, quote, disorders, diseases, and every time they have a patient in the office, they tell you that this new invented disease is a real disease. And that's the way they make a patient out of a normal person, out of a normal child, out of a normal infant even.
What you have in psychiatry is a pseudoscience. It's not scientific at all. It is a diagnosis of fabrication. It's a fabricated illness. So now you have the psychiatrist wearing the mantle of MD, but it's a pseudo mantle because he doesn't do tests. He doesn't do blood tests. He doesn't do physical exams.
If we just stop here and we step outside the biological brain disease model and we look at the actual facts and the actual data, there are no facts and data supporting the brain disease model, and there's no facts and data supporting many treatments and many things that psychiatrists claim.
There is not one shred of credible evidence that any respectable scientist would consider valid demonstrating that anything that psychiatrists call mental illness are brain diseases or biochemical imbalances. It's all fraud.
It's bogus that you can even accurately identify who has the behavior of schizophrenia. It's bogus that you can tag it to genes. It's bogus that you can detect those genes through any kind of test. So the whole thing is basically bogus.
So we can theoretically find a way to drug every set of symptoms that's different from what we think should be normal. So we could have hundreds of different situations and diagnoses in the future in which we're attempting to drug. So you just extrapolate that over a couple of generations, and it could be the fall of our civilization.
We're spending millions, billions on the totally fraudulent contrivances of psychiatry.
To me, this is a house of cards. And you can take off one or two cards at the top, or you can knock over the whole thing. I prefer knocking over the whole thing.